Measles was first discovered in the 9th century by a Persian doctor. In 1912, measles became a nationally notifiable disease in the United States, which required all U.S. healthcare providers and laboratories to report all diagnosed cases. In the first decade of reporting, an average of 6,000 measles-related deaths were reported each year. In 1957, Francis Home said that measles is caused by infectious agents in the blood of patients, which then began the process of determining a vaccine. Measles first enters the body through the eyes, nose, and mouth. Infection first starts in the lungs. Measles is very good at infecting the body's first line of defense, also known as macrophages. Macrophages guard cells that protect the cell from infections. Then, the virus takes over the cell and transforms it into a dangerous producing center. This cycle continues over and over again until millions of measles viruses are in your body. This is very effective in affecting other cells. While the measles virus is creating more and more of itself in order to infect the body, natural killer cells patrol the body and order the foreign cells to kill themselves. This is so effective for the first 10 days you will not even know that you have measles. Then, as the virus continues to reproduce, measles then go after the brain of the immune system, also known as dendritic cells, and use them to enter deep into the body. In the lungs, millions of viruses attack the immune defense system. This is when you start coughing out millions of measles viruses, which ultimately affect other people. Other bacteria can now enter the lungs which have not been able to before because of the weakened immune system. This can cause horrible diseases such as pneumonia, which is the most common way to die from measles. But the body is not done yet. Some dendritic cells survive long enough to activate antivirus forces in the body. Plasma cells in the lymph nodes start producing billions of antibodies. Antibodies are tiny cells that mark the virus for destruction or clump the virus together. Killer T cells flood the body and kill infected cells left and right. After 2 to 3 weeks, the body normally gets the upper hand of the virus and overwhelms the infection. Although your immune system is now weakened and will take weeks or even months to recover, congratulations, you are now immune from measles. Although the most common symptom of measles is the red blotchy rash that people get on the outside of their skin, other symptoms include muscle aches, high fevers, often as high as 104 degrees, fatigue, dry cough or a hacking cough, sore throat, diarrhea, headache, loss of appetite, runny nose, and watery eyes. Although there are many symptoms associated with measles, oftentimes they do not come all at once and sometimes come in different spurts. For example, 2 to 3 days after symptoms, Koplik spots begin to form on the inside of the mouth. These spots are highly characteristic of the early phase of measles, which can lead a person to realize that they've been exposed to the virus. The spots look like tiny grains of white sand, each surrounded by a red ring. They are found especially on the inside of the cheek, opposite the first and second upper molars. Depending on how long your measles symptoms last for, these spots could be in your mouth for up to several weeks. About 3 to 5 days after symptoms first present, you start to develop a typical measles rash. The blotchy skin rash consists of small raised bumps that form on the surface of the skin. They normally start on the face and hairline and eventually spread down to the neck, arms, legs, and feet. When the rash appears, there is normally a high fever, oftentimes as high as 104. The skin rash is also very uncomfortable and often itchy. Measles is the most contagious transmissible virus. It is spread through the air by respiratory droplets produced from coughing or sneezing. It remains infectious for up to 2 hours in the airspace or nearby surfaces. If one person has measles, 90% of the non-immune nearby people will become infected. Humans are the only natural host of the virus. One person with measles can spread it to 9 out of 10 unvaccinated people around them. There are also complications due to measles. If some people have the virus bad enough, they do need to be hospitalized. Some people, because of their weakened immune system, especially in the lungs, develop pneumonia, which is the most common way to die associated with measles. Some people also have encephalitis, which is swelling of the brain. This could cause long-term damage, and if it progresses to this point, there is a 20 to 40% chance of death. In 1954, John F. Enders and Dr. Thomas C. Peebled collected blood samples from several ill students during a measles outbreak in Boston, Massachusetts. They wanted to isolate the measles virus in the students' blood to create a measles vaccine. One of their students was 13-year-old David Edmonston. They were able to isolate his blood. In 1963, John Enders transformed their Edmonston B strain of measles virus into a vaccine and licensed it in the U.S. In 1968, an improved measles vaccine developed by Maurice Hillman and colleagues began to be distributed. The vaccine, called the Edmonston-Enders strain, has been the only measles vaccine used in the U.S. since 1968. The measles vaccine is usually combined with mumps and rubella, also known as MMR. The measles vaccine is first injected into the body, which contains a live virus. The dosage is harmless, resulting in very mild symptoms. Some people don't even experience any symptoms. The immune system fights off the infection caused by the weakened virus, and immunity develops. 84% of all humans are vaccinated, and many of which are vaccinated during their first few years of life. In 1978, the CDC set a goal to eliminate measles from the U.S. by 1982. By 1981, the reported case of measles was down 80% compared to the previous year, based on the widely used vaccine. Measles was officially declared eliminated, which means an absence of continuous disease transmission for greater than 12 months from the U.S. in 2000, all thanks to a highly effective vaccination program and better measles control. Globally, there are about 36 cases of measles per every 1 million person. Of that, there are about 134,200 deaths annually. For every 1,000 children that will get measles, typically around the age of 5 or under, about 2 of them will die. Despite there being a measles vaccine and about 84% of all humans vaccinated against measles, there are still a rise of cases in underdeveloping nations due to lack of medical supplies, equipment, education, and lack of access to vaccinations.